Gentlemen, let's have an honest talk. If you're an older man and you masturbate, I need to ask you something. Have you ever wondered if it's still healthy after 50, 60, or even 70? Or maybe you've worried quietly, am I harming my hormones? Could I be damaging my prostate? Is this somehow weakening me as a man? If you've ever had those thoughts, I want you to know this. You're not alone. This is one of the most common yet least talked about concerns I hear in my clinic. And most men are left in the dark, surrounded by myths, outdated beliefs, and conflicting advice. Today, we're going to clear the confusion, strip away the shame and the noise. Science actually paints a reassuring, even empowering picture. Before we dive in, do me a favor, comment below. Where are you watching from? I love seeing how far our men's health community reaches. And while you're here, hit like and subscribe. It helps us keep bringing you honest, stigma-free conversations. Here's a myth you've probably heard. Masturbation is unhealthy after a certain age. It drains your energy. It ruins your hormones. It weakens you as a man. You might have heard this whispered in locker rooms, passed down in old cultural teachings, or read online in forums that aren't exactly trustworthy. Here's the truth. Modern science disagrees. Self-pleasure is not a guilty habit reserved for youth. In fact, it can be one of the most natural, protective, and therapeutic practices for men as they age. But here's the catch. Like anything, it depends how you do it. Done with awareness and moderation, it can boost your health. Done recklessly, it can carry risks. Today, I'll walk you through both sides, the 10 benefits science has uncovered and the 10 risks you need to watch for. By the end, you'll have a clear action plan to protect your prostate, hormones, and confidence. For those of you new here, I'm Dr. Jocelyn, a urologist and sexologist. Over the past 5 years, I've specialized in helping men over 50 protect their prostate health, improve intimacy, and restore confidence. And I can't tell you how many men have sat across from me, lowering their voice to a whisper. Doctor, be honest. At my age, is it still okay if I touch myself? Every time I remind them, you deserve real answers, not fear, not shame, not half-truths. Here are the 10 benefits of masturbation for older men, explained biologically, emotionally, and practically. Benefit number 1, maintains penile health. Think of masturbation as a physical therapy for your penis. Biologically, each erection pumps fresh blood into the spongy tissue of the corpora cavernosa, keeping tissues elastic and preventing fibrosis. Emotionally, preserves confidence. Nothing undermines dignity faster than fearing your body won't respond when you need it. Practically, keep the machinery in motion regularly and it stays reliable. Benefit number 2, supports prostate health. This is a big one. Science. Harvard researchers found men who ejaculated at least 21 times per month had a 33% lower risk of prostate cancer. Biologically, ejaculation flushes old fluid, toxins, and inflammatory substances from the prostate ducts. Emotionally, replaces fear with empowerment. You're protecting your prostate. Benefit number 3, strengthens the pelvic floor. Biologically, the contractions during orgasm exercise your pubococcygeus and surrounding pelvic muscles, improving erectile strength, ejaculatory control, and bladder function. Emotionally, a stronger pelvic floor gives confidence, reduces worry about accidents or leakage. Practically, it's like a free workout with benefits far beyond the bedroom. Benefit number 4, lowers stress hormones. Biologically, orgasms reduce cortisol, the main stress hormone. Lower cortisol improves blood pressure, heart health, and reduces anxiety. Emotionally, imagine lying down after a stressful day and drifting into calm sleep. Practically, helps you feel less tense and more present in daily life. Benefit number 5, boosts mood chemicals. Biologically, orgasm triggers dopamine and oxytocin release, the feel-good and bonding chemicals. Emotionally, uplifts mood, combats depression, promotes connection. Practically, you carry more patience, positivity, and presence into your day and relationships. Benefit number 6, improves body awareness. Biologically, regular self-touch makes you familiar with your anatomy, increasing chances of catching early changes like lumps, curvature, or pain. Emotionally, knowledge replaces fear with confidence. Practically, men have detected early testicular cancer or Peyronie's disease simply by knowing their bodies. Benefit number 7, enhances sleep quality. Biologically, oxytocin rises, prolactin increases, cortisol falls, the perfect recipe for restorative deep sleep. Emotionally, sleep is rejuvenating, reduces irritability, and restores energy. Practically, helps those struggling with insomnia naturally. Benefit number 8, improves pelvic circulation. Biologically, beyond erections, masturbation boosts blood flow through the pelvic region. Emotionally, promotes a sense of internal health and vitality. Practically, supports bladder control, healthier prostate tissue, and reduced stagnation. Benefit number 9, trains ejaculatory control. Biologically, techniques like stop-start or squeeze improve awareness of arousal. Emotionally, builds confidence, reduces anxiety about performance. Practically, leads to better control with a partner. Benefit number 10, keeps desire alive. Biologically, regular stimulation keeps the neural circuits of arousal firing, preventing sexual shutdown over time. Emotionally, protects sense of masculinity, even if you don't have a partner. Practically, ensures readiness when intimacy comes your way. These benefits are encouraging, but like anything, there's a flip side. Let's explore the risks and how to avoid them. Here are 10 risks to watch for and how to mitigate them. Risk number 1, social isolation. If masturbation replaces real intimacy, it can increase loneliness. Fix. Use it to complement, not replace, human connection. Risk number 2, skin microtears. Too much friction without lube causes inflammation or infection. Fix. Use a quality water-based lubricant. Risk number 3, desensitization. Same routine or pressure can reduce sensation. Fix. Vary technique and rhythm to keep the brain engaged. Risk number 4, masking erectile dysfunction. Solo performance might hide underlying health issues. Fix. If difficulties arise, see your doctor. Risk number 5, nerve compression. Poor posture, like hunching over, can pinch nerves. Fix. Lie down or support your body during sessions. Risk number 6, emotional escapism. Relying solely on masturbation for stress relief can create dependency. Fix. Pair with exercise, social interaction, meditation. Risk number 7, guilt and shame. Cultural or religious beliefs can weigh heavily. Fix. Consider speaking with a sex-positive therapist. Your body is not your enemy. Risk number 8, pelvic congestion. Both infrequent and excessive ejaculation can cause discomfort. Fix. Moderation is key. Listen to your body. Risk number 9, semen quality reduction. Daily ejaculation may reduce sperm concentration if trying to conceive. Fix. 2 to 5 days of abstinence can optimize semen quality. Risk number 10, disconnection from reality. Excessive reliance on extreme pornography may hinder real-life intimacy. Fix. Limit porn, focus on touch, imagination, and memory. Keep it regular, but moderate. Use lube to protect your skin. Stay aware of posture. Mix techniques to avoid desensitization. Never let it replace intimacy or connection. Think of masturbation as a tool. It can build or harm depending on how you use it. Gentlemen, I know this is deeply personal. Many of you have carried questions, shame, or fear since your teens. Let me reassure you, there's nothing shameful about your body. Science is on your side. Your prostate, hormones, and mood all benefit when you approach this consciously. Age is not the end of vitality. It can be the beginning of wisdom. Masturbation, when practiced with awareness, is maintenance, self-respect, confidence. If this conversation was helpful, like, subscribe, and share with a friend who needs to hear the truth. I'm Dr. Jocelyn, reminding you, your worth is defined by how you care for yourself, not by age or shame. Stay strong, stay confident, and remember, you are enough and your body deserves respect.